Welcome to Session O of the SQA September virtual meeting. My name is Allison Cockrell, and I will be the chair of this session, which will include the following presentations and speakers. Business Resilience and Embracing Technology During COVID-19, the Good, the Bad, and the Unacceptable, presented by Milind, Nadgouda. The Art of Remote Auditing, a Practical Guide, presented by Chandra. The presentations in this session have been pre-recorded and will be broadcast in the order listed here. Please note that some of the talk titles and the names of presenters may have been updated since this was recorded. At the top of the screen, you will see the list of speakers for this session. Click on the speaker's name to view their profile and read more about them. The presentations today represent the presenter's opinion, not necessarily those of SQA. You can submit questions and share comments throughout the presentation using the chat function. Click on the chat button at the top of the screen. This will open the chat at the bottom of the screen. The presenter will do their best to respond to questions via the chat while the presentation is being broadcast. If there are a number of unanswered questions at the end of the session, the presenter will provide written responses after the virtual meeting has concluded. These written responses will be available along with the recordings and the slides. There will be a brief pause between the broadcast of talks within the session. Once all the recordings have finished playing, the session will end and there will be a break until the next session begins. Be sure to consult the schedule to confirm what time things will resume. Recordings and slides that have been released by the presenter will be available in the on-demand menu in the virtual platform. You can view these recordings at any time. During breaks between sessions, you're encouraged to visit the virtual exhibition hall. Here you can visit the exhibitor booths and view virtual posters. We will have a prize drawing for visiting booths in the exhibit hall. You will earn 30 points for each exhibitor or poster booth you visit. Once you've earned over 450 points, you will be entered into a drawing to win an Amazon gift card. Thank you for joining us for this session. The presentations will now begin.
Welcome back, everyone. I'm sure you've had a good break, have had enough caffeine, and are already in set to listen to what we have here for you. We are going to talk a little bit about business resilience and embracing technology during COVID-19. We've titled our presentation as The Good, the Bad, and the Unacceptable. This is going to be a two-part presentation. Firstly, the business resilience piece, which is what I'll be talking about. And that'll be followed by the embracing technology piece, which my colleague Yogesh Agarwal will be dealing with. Let us straight dive into what we want to talk about today about business resilience. For starters, as the saying goes, you can't prepare for everything, but you can really prepare for anything. A bit philosophical to begin with. But I guess that's how things are. Considering what we have been going through, an extraordinary situation. I'm sure you're tired of hearing that. But are we really prepared for everything? Can we be really prepared for everything? And have the industry and organizations which represent this industry and are part of it, have they prepared for everything? Did everyone think about everything in a sense? And have they been able to build in that resilience that is required within the industry? Let's start with talking about what business resilience really is. You must have heard this term. It is a buzzword, of course, but it does come with a meaning to itself. We have commonly heard what business continuity means, what the plans for business continuity are, and any reports that are associated with it. These are all part of the QA oversight we provide on a fairly regular basis. During all audits, we do make sure that we look at business continuity plans, the reports, testing has been done, all of that. But business continuity planning, or BCP, as it's widely known, does not equate to business resilience. So what really is this business resilience? Let's look at it a little more in detail. It is actually the ability of an organization that it has to quickly adapt to disruption whilst maintaining continuous business operations, making sure that they're safeguarding people at the same time, safeguarding their assets, and overall brand equity. Business resilience begins with an understanding that workflows must be preserved in order for organizations to survive unexpected events, such as this pandemic that we are going through. An often overlooked challenge of business resilience planning is the human element, whereby individuals in a chaotic situation must be prepared and educated on how to respond accordingly. Business resilience really goes a step beyond disaster recovery, business continuity, and it does so by offering post-disaster strategies to avoid costly downtime, shore up vulnerabilities, and maintain business operations in the face of additional unexpected breaches of some sort. Although we are not at the end of it, we are still seeing some level of recovery happening at different organizations. Each organization has its own strategy as to how they are going to come back or recover. So going back to it all, business resilience planning requires preventative and proactive protections across all aspects, all systems, technology, and everything that's associated with making the operations happen once again. As I said earlier, the human element, the staff, human resource, that is going to be a key element always. Let's look at how the industry has reacted to this situation. The industry has reacted as a whole in a very positive manner. The reaction is, as they say, as positive as it can get. The initial safeguarding was, of course, essential, but what went on in the background within most corporates within the industry was to ensure that there is no disruption of supplies of essential medication. This is to the general public as a responsibility. There was no compromise on health whatsoever, whether it was for their own personal, that is employees who were completing their day-to-day tasks, but at a larger scale, there were efforts to minimize impact on public health. This was completely supported and wholly supported by the governments across the world, as you have seen. Some key features, however, that came out not just good, but excellent are the ones that I have put here on the slide. They are in no particular order, but I just had to put them in with those numbers just to make sure that we cover them with the right impact. The first one up there, the swift action for a treatment is what I'm calling it. Be it symptomatic treatment regimens or preventative treatment possibilities. The biggest thing that we have seen is the 80 of 139 projects worldwide for vaccine research for COVID are in clinical stage of development. That just emphasizes the resilience of the industry as a whole. It also talks about those individual organizations which have made it possible. The contributions of the industry in the economy worldwide has been really upheld as well. As you can see, the money bags in number 2 up there. It really shows that the industry has been instrumental in pumping in 36,000 million euros in the economy for various stages of research that supports the industry's idea of resilience. Just another example of how an industry as a whole has been responsible for making things happen and making sure that business continues the way it should. This is an example from Europe. I'm sure there are similar examples of the industry supporting the economy across the world. The third aspect there, the regulators have not stayed behind in this whole resiliency aspect. The regulators are supporting the industry, and their reaction also has been equally positive. We have had instances of remote inspections, additional guidance documents, specific meetings with industry bodies, and much more. One of the examples that I quote here is that of the EMA's notice to stakeholders. Sorry, I'm a bit partial coming from this side of the Atlantic, but yes, it is the notice to the industry. This one focuses on the regulatory expectations that EMA has as a competent authority from the industry. Another example of industry's resilience, a good in that case. The pharmaceutical and medical device industry bodies have not just within its area of expertise contributed towards resilience, but have involved other industries which were no way connected with the medical pharma industry in any sense, but they have made this possible. There are examples, multiple examples that we can give. And one of them that comes to my mind is again something from my very own country, the United Kingdom, wherein we have a ventilator challenge initiative that included automobile industries like Ford, aerospace players like Airbus, technology companies such as Microsoft, and medical device manufacturers such as Siemens coming together to make ventilators happen, and at a very quick space too. If this doesn't sound resilience, what does? Let's look at some specific outcomes that we have seen. There have been quite a few important outcomes from the reactions of the industry to the pandemic. Each organization, depending on its maturity levels of handling business continuity and managing crisis, have displayed their resilience. These key outcomes are common across the industry. Without naming any names of organizations specifically, you will all agree that if not all these 10 items listed here, majority of these key outcomes have been common across the organizations. Let's take supply disruptions. Supply disruptions has always been a threat that is included in all planning exercises for business continuity. This is common across the industry. But the impact of supply, in this instance, the impact of supply from China, which supplies nearly 70% of raw materials for the industry, has been prominent. But careful planning and astute strategies that have been put in place have ensured minimal supply disruptions from big pharma players to small biotech manufacturers. This has been consistent. Of course, there are outliers, but this is one of the big key outcomes, a good in that sense. Supply disruptions have always been a threat that is included in all planning exercises, as I said. But what has gone hand in hand is the 24/7 manufacturing, albeit not for all manufacturers, but definitely for essential medicine manufacturers, vaccine providers, key essential medical device manufacturers. This has helped no disruptions in the supply of medications to the end users. Apparently a good scorecard for the whole of the industry, I must say. Big, medium-sized and small firms, all alike within our industry, have championed stakeholder communications very well. They have used all available modes. The multimedia approach has been effective to keep all stakeholders informed of what they as an organization are doing and how they are reacting. Very key outcome during such times of uncertainty. What else has gone well? Clinical research continuation, very, very important aspect, significant one in terms of outcome, especially when the healthcare system was stretched to cope with the influx of patients suffering from COVID. The continuation of clinical research and compliance has been substantial with the use of technology. Things such as remote monitoring, remote auditing, and risk-based approaches have helped in this activity. Critical resource identification in the business continuity exercise has been instrumental in success of most organizations, leading to a key outcome of identifying all business critical aspects, linking them to recovery times, ensuring how they can be brought into action, and maintaining continuity. Another win, I must say, another good. The pandemic has had large implications on the finances of the organizations. How they treat their cash flow, what they spend on, and what is justified are some of the key financial considerations that have been brought into the forefront. Finance managers within organizations have worked alongside the business continuity experts, and they worked closely to give meaningful and clear directions for spends during these times. Of course, there have been some tough decisions across organizations that have impacted some jobs, but as an organization, its survival and necessary decisions must have been taken. 3 items on this slide can be put in one bucket. That is the response from an organization's perspective. This has not been completely done across the industry as such. Invoking of business continuity is another one, and incident response and recovery planning falls next. So this particular bucket of these three items is what I would say as particularly not good. I don't want to term it as bad, but it is definitely up there where it could be borderline bad in that sense. So out of the good, the bad, this could be one of the ones that has happened out of it. Again, to be fair, here, large pharma and mature organizations have got this one and they've got it well. So you can say it's half good and half bad there. Let's look at a few unacceptables. So what is the absolutely unacceptable aspect that we have seen? Each organization writes a business continuity plan. Each organization thinks about how they want to recover once there has been an incident. But there have been many organizations which have not included disruption due to pandemic in their business continuity efforts. It now seems as though hindsight was always better, but that's not what we are dealing with. The companies have thought that putting pandemic as an item in their business continuity efforts would have meant that there should have already been a pandemic, which was many decades ago. And why would it repeat again? But what do we have now? We do have one at hand, and we are now dealing with it. So consider this. Just as an example, although not relevant to the industry that we are in, but the Wimbledon organization in the United Kingdom has been paying into an insurance for disruption due to pandemic for many years. They had put this as part of their exercise, and now they're able to sustain that, at least on a financial front, in terms of that particular insurance being their backup in their business continuity efforts. Other aspects which are not as acceptable, which are put up here, again, without reading out every one of them there in detail. But as you can see, some of these actions need to be part of the business continuity in a very succinct manner, in a manner that it can be actioned upon. Things like halting R&D activity, most easiest thing to do. Do they really have to do it? Of course, if it is not identified as a critical element, then you can go on and halt it. But what it means in terms of your continuity, what it means in terms of your business resilience, those are the questions that you need to answer. And many organizations have done that. They've halted R&D activity. Not so good, perhaps unacceptable to an extent. So going through this particular list in terms of what we are expecting as unacceptable, you can see that most reactions by business have been knee-jerk and very symptomatic in nature. So what are we going to look forward to next? I am coming to the close of my discussion on this one. I did talk about the good. There were quite a few goods. I did talk about a few bads, and of course the unacceptables in the previous slide. Looking forward, wish we all have a wonderful crystal ball which could tell us what it is and what it means to look forward into and what it is that we can build. This is a model that we at RiverArk are proposing to some of our clients, and it's a simple 4R model that we are saying, specifically when you're looking at the business resiliency, not just continuity exercises. And I call it the 4R model. As you can see there, you're considering these aspects, of course, in perpetuity, and you are considering these aspects in a manner that it is going to be meaningful and right-sized for your business. So what are these things? What are you looking forward to? Simple and achievable things is what I'm suggesting on this slide here. The first R being refresh. So what is it that you need to refresh? You need to refresh, make sure that all contact information of critical personnel and vendors is up to date. If you have any kind of a business continuity exercise that you have run, have you documented adequately? Have you put in all the details that are necessary? Have you made sure that there is the data that needs to be updated within the appropriate systems, has it been updated? So refresh. So make sure that you're refreshing all key information. What other things can you do? You can review. You need to review everything. Review everything in terms of what your recovery time objectives were before this. What were the actual recovery times that you obtained? Had you identified the really critical elements? Were there new critical elements that were thrown up during this stage? And everything in a sense that has impacted for business continuity. Look at it, review it thoroughly. The third R, as I would call it, is reflect. This is perhaps the most important of all these ones which I have mentioned here. Here, you've got to use the incident to track points of friction, confusion, failure, and understand the process where things were better, where things failed, what all could be done better, the lessons learned out of it, document the lessons learned, document failures, document points of critical elements within the process whilst it's being executed. And make sure that those become part of your exercises going forward. Last R there is the report, as we would call it. This is all about communication. We said earlier on that communication has been good during these periods. As you agree, most organizations have reached out to all the stakeholders in a nice manner. By that I mean they have put up communications which are easily accessible in the format that most of their clients will be accessing, using the internet, using social media, making sure that it is available on all multimedia options. So look at reporting all of this once again. Consider reporting to all key stakeholders. And here I mean not just customers. Think about regulators. Think about regulators outside of the drug regulatory authorities that you have, that you may need to report these things to. Perhaps your health and safety reports. Perhaps your local council that you might need to report into. Aggregate your risks. Consider all activities and incident information internally. Internalize it to an extent where it goes to senior management in an appropriate manner. Think about all the timelines that you want to consider for such reporting. Once again, much more critically, think about all sorts of incidents management reports that you want to have included based on this example or based on this live situation that you have dealt with. So this 4R approach will actually, it's nothing new. It is fairly similar to what you would do as a business continuity and business resilience exercise. It is just making sure that it is done in a structured manner, making sure that it is available and making sure that it is giving you tangible data that you can use within your organization. That really is my last slide. Now I would like to hand over to Yogesh Agarwal. Yogesh is a principal consultant within RiverArk and is a technology security consultant. He's also a certified fraud investigator. Over to you, Yogesh.
Good morning, everyone. My name is Yogesh, and I work for RiverArk as a principal consultant. I have been in the technology audit space for last 17 years, working with financial, pharma, manufacturing, and technology sectors. Currently, we do a number of independent audits around technology, and what I would want to bring forward is our learnings and experiences of how different companies have handled the current situation. There have been some companies which have handled it very well, like smooth as silk, while there have been quite a few where there are more lessons to be learned and other additional things to be put in place just because of how they have handled the current situation. Let's focus on three core things in this session. The first one being how the technology has evolved. How has this impacted the regulatory environment and the assurance environment? And the third bit being, what can we do to ensure that we are able to provide a continuous high degree of assurance to the organizations around the technology space? Talking of survival, the one thing that did survive is the internet. No data centers got burnt. It did not fall apart. There were no blackouts or outages, and our home connections held up well to all these Zoom and team meetings alongside our kids attending their online school sessions or watching their favorite TV shows. You can see the statement on the screen, which says that the internet was made to survive just such an emergency. I don't think so. I believe the internet was made to feed us Netflix, Amazon Prime, TikTok videos. However, the COVID-19 came along and we have started hogging all the bandwidth for our Zoom calls and team meetings and Slack conversations. There's one thing I would want to highlight in this situation is that there is a clear divide between the haves and the have-nots. So people with very good internet connections are much less likely to get impacted by this virus. The more they should worry about is the computer virus. As customers and employees, we are getting used to being virtual, and digital services are there in every sphere. Just as an example, we are holding this conference virtually. Believe me, this is my first experience of actually recording a conference without a live audience. There are things like touchless terminals, electronic collaboration tools, health screening, and thermal scanners, which you will see probably even continuing even after the current time. There are quite a few developments which were considered a novelty. However, they are going to become mainstream as we realize the advantages of these technologies. Let's now start looking at a few things that I have picked up for this conference. Digital transformation is one of my favorites. Normally, the driver for a digital transformation is a process change or a business change or a change in the customer experience or a new model being implemented. These digital transformations are generally driven by the senior management, normally the CTO. Cloud migration, collaboration tools have been on the agenda of many companies for their digital transformation journey. However, the current situation has just brought them forward at a very fast pace, and now these are the bits which are being considered before anything else. Now, of course, there is a question on the screen. Please feel free to use your chat windows to give your opinion on who do you think is driving the digital transformation within your company in the current situation. Telehealth and telemedicine are one of the front runners that have emerged. So the CDC in the US and the NHS in the UK were both very prompt in producing the online symptom checkers, and they had quite a bit of algorithm going in the background, even with some human interventions, to determine whether a person is symptomatic and whether that person needs to come to the hospital for admission or further treatment. This has helped prevent spread of the disease because less people are traveling to the clinics. Things like telemedicine, having video consultations with the doctors has also made sure that the infections are not being spread unnecessarily, because the doctors can in many cases advise the patients while on a video call and have the prescription sent online. Now, the good thing emerging out of it is that in the longer term, it might be a solution to the queues at the GPs, the queues at the pharmacies to collect the prescriptions, and of course, reducing the risks of contamination just besides this only virus. We are still to see how many patients will fall victim to the incorrect diagnosis though, because in many cases, the doctors would want to see a patient in person, and an online video diagnosis may not really bring out all the correct symptoms that the patient is facing. Talking about 3D printing, this has been a very interesting area, and lots of people, mostly hobbyists, have started doing 3D printing even at their homes. There are some companies who have adopted 3D printing at a large scale. And we saw that some companies managed to use their 3D printing facilities to start producing what we call the PPE, the visors, etc. In the UK, the McLaren F1, they managed to convert their facilities to produce lots of equipment for respirators and the personal protective equipment for the doctors. And the big thing is that the raw materials for 3D printing are easily available. You can produce anything that is needed in small quantity at a low cost, and as long as you have the correct equipment and the correct CAD design, the output will normally be of an acceptable quality. Genetics, they always bring some mixed emotions. It's quite a bit of research which is happening in this area. Again, genetics allowed us to get the whole virus code sequence within 2 weeks when this was made public. And then the thing that most concerns around genetics is the protection of the genetic material, the protection of the genetic code. And the question for us is, could these technologies help us bring the new virus killer? Could these technologies help actually contain not this, but all other viral infections by use of the gene editing technologies? Normally, any change by regulators is considered very difficult. In many discussions, they come as the elephant in the room, something not to be talked about. However, it seems like the elephant has started moving. We saw a lot of announcements coming out from the FDA, particularly around inspections and audits and doing the remote vigilance audits, as well as some announcements from the EU side where they are relaxing some very strict regulatory and technology requirements against, say, telemedicines. We have also seen the HHS giving a number of exemptions and exceptions because of this pandemic, which was not a norm until some time ago. All these changes don't come without massive challenges. And what I would like to do is to bring to perspective some challenges which are more real, the challenges which are now, not in the future, and which are going to impact the assurance environment as it is happening. I'm not sure if this question has already been asked of you, but this is something that I always wonder about. Where is my network boundary? So until some time ago, the corporate network was the network boundary. We had all the data in our data warehouses behind an enterprise grade firewall, and the devices were behind that firewall. As soon as the employee leaves the building, they leave the data behind. Now, what has happened is the boundary now has moved to the $100 home router, which can be bought off the shelf. Normally, no one even would have bothered to change the passwords, and the password would have been shared with the family, friends, kids, friends. And it's this device which is now protecting the corporate information, which was previously held behind these enterprise grade firewalls. These networks would also connect like a normal domestic network to things like PlayStation, Xboxes for that matter, your listening devices like Alexas, and then also the smart home techniques, which may not always be as secure as uh, we would like to be. Now, because these network boundaries are blurring, the perimeter where the security should be implemented is also blurring, because now whether the boundary is the corporate device, whether the boundary still remains, say, the corporate firewall because people need to VPN in, or it is moving to something like a home router, is to be analyzed in much greater detail when we are doing a network risk assessment. Bigger question, where is my data? So we previously saw the usage of data through the internet has spiked significantly. The reason is the data has now moved from the corporate data centers into what we call the file share systems like Box, Dropbox, and OneDrive, because they are easy to access. Users are realizing that they can have access to the corporate data on their mobile phones. Also, there was a huge rush for moving the data using USB sticks so that people could work from home initially. Now, we don't know whether those USBs were encrypted. We don't know whether these apps have been configured securely. What are the sharing permissions which have been given on those apps? And also whether those are being accessed on insecure devices. At a higher level, data residency becomes a key issue. So for example, do we know where is our core data held? Is it in a data center in the US, or has it been moved to a data center in the Far East for backup reasons? And whether there are multiple copies of this data being spread across the globe to maintain the resilience being offered by these cloud sharing companies. Privacy remains a big concern, because now the access to this data could be possibly with the users who the company doesn't know. Data retention is a big issue. Normally, if your data was consolidated at a central place, it is very easy to apply the retention policies. However, if you have made multiple copies of the data, to apply the same retention to every copy of the data will become very challenging. We have already seen issues around version control happening, where sometimes the core data is not in sync with the data that has been used by the employees when working from home. And the secure deletion also remains an issue, because we will never be sure if we have been able to delete each and every copy of the data that is out there. I would not want to exclude the human aspects of this technology change. We have already seen the blurring boundaries between personal and professional life. So people are working from home. They are exposed to what we call the domestic risks in terms of, for example, sharing a computer at the same time, which is also being used for work. The working styles, work hours, and flexi working are now a big peak, and it is going to have an impact on the data privacy, data security, the overall assurance regime that an organization would have liked to follow. User adoption. in quite a few cases, the user adoption has not been quite straightforward. So we are asking users who were very used to working in an office environment to then work in an environment which is not designed for work, using technologies that they have not ever used before. And if the human aspects are not taken into consideration, the acceptance of these technologies might be at a very high risk. Change management has taken a backseat in quite a few situations because we simply didn't have time to apply proper change management practices. It is a business continuity, a disaster recovery situation. So what that has meant is things have been put in place in a rush, in a hurry, to make sure that we can make it work. Now, looking at how the technologies are evolving in the security and the assurance space, you will hear this term quite often in the near future, a thing called zero trust. What it simply means is don't trust anyone, don't trust your user, don't trust your device unless they have authenticated. So a company must verify anything and everything that is trying to connect to its systems and accessing its data before granting access. What it means is, suppose you are an employee of the company, you have been verified using your phone multi-factor authentication, you are accessing your information which is considered normal or for the work that you do, and you are coming from a trusted IP address, you are in. If those conditions are not met, then you are out. So things like single sign-on technologies where you have just one user name, one password to access all the company resources, multi-factor authentication where you are always verified using a mobile phone or another device like hardware token, device health where your device through which you are accessing the data is being continuously monitored for malware, misconfigurations, and vulnerabilities, and conditional access where if the conditions are not met, the user experience will be slightly different. So for example, if you are trying to access a company system at 3 in the morning, what might happen is it might raise an alert because it is an unusual behavior. It has not been seen before. Now, if you are trying to access a system at 3 in the morning from an IP that is untrusted, say it's not coming from the US, and then what is happening is that ID is trying to download huge tranches of data. In that case, the systems will put a temporary block on that user until someone can intervene and confirm whether it is a genuine activity. And this all is happening by the learning algorithm that is working in the background, which is analyzing how a particular user behaves using their technology systems. One of the key concerns emerging is it going to become a vigilance state? Are these companies now going to monitor each and every aspect of how a user works? We even talk about the technologies which are actually recording when people are working from home, technologies which are recording the keystrokes, the time spent on the devices to make sure that people are productive while they are working remotely. Now, it will be a wider question around the trust that we place in the technology, the trust we place in the individuals, and how organizations generally evolve in their ways of working. There are quite a few developments happening around data security as well, because the perimeter of security is moving to data. And again, we are seeing these terms gaining ground like data-centric security. So encryption has been there for quite some time. The new paradigm is how secure is your encryption, how you are managing your security keys, how you are making sure that your key rotation is secure. The next bit is actually doing the detailed audit trail for data flow. Who shared that data, when it was shared, who has made edits to it, who has seen that data, all this being basically appended to, say, a file in their history, which then tracks if there were any unauthorized changes or any unauthorized access which was done on the data. Self-destructing documents are becoming very popular. These are the one-time documents which will self-destruct after a user has accessed it. There are technologies which can place restrictions in terms of how many times you can view that document. And if the document is being accessed by an individual who doesn't have access, the document will delete all copies from every instance that existed as long as you have an internet connection. The corporate laptop used to be considered as a very secure device, but not anymore. We are hearing a lot more discussion around the app containerization and browser containerization, again moving the boundaries to the application and the data contained within the application, not trusting any device even if it is a corporate build. The remote desktop offerings from Azure and AWS are gaining quite significant ground. What it means is you get the same experience as if you are working on your own computer while the data is safely held in the cloud, in the respective data repositories. Now, these are slightly different from the VPN experiences where you were actually transferring loads of data between your desktop and the corporate network, while these remote desktop sessions using the virtual desktops allow you to use the full power of the cloud without a very good internet connection. So just as soon as you have a decent internet connection, you can still access the full power of the cloud in the background. All these developments don't come without major concerns and headaches for the assurance community. Let's start with privacy. So the medical data, contact tracing apps have been a big discussion point in terms of who is accessing that data, what is the privacy expectation of the individuals, where else will this data be used. Social media has played a part where, for example, if a celebrity has shown any symptoms of coronavirus, it's been all over the news, and then our media has gone down to finding out their past medical histories and what the individual is doing in the hospital, out of the hospital, whether their family members are affected or not. When these changes are happening, there are some crucial aspects which are being ignored, like employee training. Normally, in quite a few organizations, the training has been done more as a checkbox exercise rather than a fair attempt to make sure that the employees are comfortable with the new technologies. Testing has taken a backseat because simply we did not have time to test. If we were doing more testing, then we would not have been able to implement those technologies to make the organizations work. And talking about documentation, in many cases, you would find that the documentation does not exist. Statistical references are important because what we call big data, lots of data is being analyzed using code and algorithm, and this code, whether it is going through a good coding practice, is a question that is still unanswered. What it might result in is incorrect statistical references. We might have situations where the outliers are included as normal. And one more thing I believe we have to watch out for is how statisticians deal with the 2020 data. What are the inferences they make out of it, and whether any normalization will be required to gain useful insights on the long-term trends based on what I would call unexpected spike. We did observe that system protocols were being bypassed when implementing new systems. What it meant was proper hardening of the systems not taking place, configuration reviews not taking place, bringing in web technologies without doing a proper penetration testing. Now, while it has been hailed as a success in terms of systems being up and running quickly, what remains to be seen is how sustainable they are, and whether we have exposed ourselves to wider risks when rushing these technologies through. Similar issue around the delegation of authorities and approval of exceptions. So one of the things that will probably be highlighted in the future evaluations and audits is how these approvals were managed, whether people went beyond their authorized limits, and whether exceptions were made which are not acceptable. Loss of intellectual property, which is one of the core bits to be protected by any organization. We don't know how many copies of the intellectual property are floating around. The security boundaries around the intellectual property may have been relaxed in order to make things work during this situation. So again, check to see how we can bring the control back around our intellectual property. Now, this is my last slide, and what I would want to do is to recap on the key takeaways. So the technology has responded well to demands placed by this pandemic. Internet did not break down. Collaboration tools were implemented quickly to make sure that people are able to work remotely. The systems have generally held on their own, and there are new technologies like telemedicine and 3D printing emerging to actually make use of the technology in a way that was not thought of before. Digital transformation, moving to the cloud, adopting collaborative technologies has become a necessity rather than an ambition, and these will be brought forward against any other major organizational changes in the IT that were planned before. In all this, the fundamentals of privacy, security, and controls has not changed. What has changed is how it is being delivered using the new technology. And to gain much assurance on these bits, what we will need to do is to keep pace with the advancements by making sure that our processes and procedures to gain assurances on these new technologies are keeping up to date. And this would mean probably retraining, re-engaging with the business, re-engaging with the technology teams, and trying to understand how these changes are going to impact the organization in the long term. That's the end of my session. Thank you for listening. I guess this is now time for some Q&A. Thank you.
Good morning. I would like to take this opportunity to thank SQA for giving me this time slot that I could talk to you about remote auditing. We definitely have had a lot of changes within the COVID for these last few months, 6 months probably here, brought on many changes and challenges for all of us to overcome. Many of them for businesses and organizations because processes aren't happening, procedures can't take on. With everyone remote working, it's just a different landscape for us. Quality being more of a hands-on job, more personal, more interactions needed. This definitely has changed how we handle ourselves. You know, I want to take this time that I can actually talk to you about how we overcame some of these obstacles and these challenges that we faced. You know, our obstacles were a little bit more compounded than probably some. We actually brought on new testing at a BSL-3 facility. We had our own constraints just from the BSL-3 side of it. We had limited personnel that could go into the building, of course. And that was actually that was mainly because of the security that you have to go through and the training that you have to be through to go into a BSL-3 facility, let alone even get into the laboratories there. And we also had most of the personnel working at home, so that way most everyone was already working at home during this time period. So what we ended up having to deal with was the fact that we had very few personnel that could go into the building itself. And then we had a lot of personnel that were just working at home. So what can we do within those issues? Well, we figured out some pretty ingenious ways that we can work around things, but it did take us some time to get through all of these challenges. So generally, when we all are met with something brand new, do a new task, do a new procedure, we always look to someone else, or a resource that we've gone to before to see if we can maybe figure out a better way to do the process. Well, generally or at least for me, when I look for answers, I'm usually trying to see, does someone have a training that's on this process, that's on this subject matter that I need help with? Are there meetings open for us to do this? Are there conferences that we could attend that, much like this SQA one, that would give us this opportunity to talk with other people? And is it in the standard or in the requirements that we're talking about? And the reality is, for us, as remote auditing is not listed in a standard. It's not in a requirement anywhere. Auditing, they have very good information about auditing, but nowhere within any of the standards that are out there does it discuss how you should remote audit. So this is completely up there in the air for us to figure out and muddle through on our own to make sure that we're doing what we need to do. And of course, we'd always talk to colleagues. So you might be lucky enough that you have somebody that's actually doing remote auditing that you could ask them for their advice, their pitfalls that they've done, how they've overcome obstacles, what they found to be one of their bigger obstacles. But unfortunately, for this first 6 months that we've been muddling through this, there hasn't been a whole lot of resources for us to look to for this. So basically, within our auditing of the pandemic, from what we've figured out, we've kind of come across a couple of situation things that we've had to deal with. So basically, our obstacles are within this grid here. We had to overcome the old auditing procedures, and I'll go more into depth than these. And of course, we had lots of challenges that we had to face, and some of them you wouldn't even think about being a challenge until you start doing the work. Risk assessments. Documentation. What do you need prior to the audit? What do you need during the audit? And what do you need after the audit? And this is an ever evolving situation for you. And so what you may start out as may not be where you end up. That was the one thing we realized. We were continuously improving our own process as we went, and it looked different from where we started. Of course, if you're talking about it being an internal audit within your own organization versus an external audit, of course, your processes are going to be different. Your scope, your purpose will be different, and it will definitely dictate how things are handled a little bit differently. And of course, defining the scope and the purpose. And we'll talk about that as an obstacle. That truly is more of an obstacle than you think it would be. You think that would be maybe the helpful thing, the easiest part of it. It's not. So the old auditing procedures, how is this a challenge? How is this an obstacle for us? Well, of course, on-site's not allowed. From our example that I gave, that we were in the BSL-3 building, I couldn't go inside of it. I didn't have clearance. I couldn't go in at all. So then we're back to these belief errors. You know, you have these beliefs that the errors and issues can only be discovered when an auditor is on site. Generally, that's the way most of us have learned to audit, because you're always looking for certain things. You want to be able to see for yourself, you know, but it's still our job as an auditor. We must be skeptical and ensure evidence is sufficient. So no matter if it's presented to us remotely or if it's presented to us on site, it's still our job to be skeptical of what we're seeing and ensure the evidence is sufficient. So it's really not different. It's just a lot more of that we have to think about things through. We have to spend the time to make sure that we really have thought our process through enough and we've asked for everything we need. Again, that's going back to the documentation. This is an obstacle that you have to look for. Now, and you also, a lot of people, and I was one of the first ones that worried about this, the missing interactions. And one of the biggest concerns I had was not being able to see the rooms. I couldn't go in the building and actually see the rooms. That was my biggest concern. You know, I wouldn't see the layout of the equipment. I wouldn't be able to talk to the personnel that were actually doing things. I didn't see the workflow. I didn't see where it started, and I didn't see how it moved through the system. So there's always these issues. If you're not on site, how are you going to find things? There are ways to work around this, and there's actually fairly ingenious ways to work around this. And we'll kind of get into that after we talk about some of the challenges. Of course, the biggest challenge is always going to be what standard or requirement, what are we actually auditing to? That's the biggest consideration, the most important thing that we have to work at or look at before we start this process. So is it regulatory based? So is it something for CLIA? Is it something for FDA? Is it something for your client? Is it a client audit that they're coming in to look at maybe a study that you've run? Or maybe you're getting ready to ramp up production and they want to come in and see what's going on with the production side of it. Maybe it's in a vendor audit. Maybe you've had to change vendors. We've had a lot of those issues where you didn't have most of the, you know, we ended up not having a lot of our resources coming to us in a timely manner. And so some people had to start scrambling to try to find a replacement. So is this a vendor audit for that scenario? Well, we're having to find a replacement for something that we needed, fetal calf serum, cell culture, what have you. And then of course it could be an internal audit that we're having of our own procedures, which those are easier to deal with, honestly, because you know the processes. You don't have to worry so much about interpretation. You understand everything from the beginning, and then you just have to move through for the internal side of it. Now, another challenge is, are you looking at it from the standpoint of, I'm going to do one section of the requirement, or maybe one study, or maybe one part of the study? Am I just doing one little group here? And then am I just doing one lab, one section, one production line? Or am I doing a full-blown audit where I'm looking at everything across the board, and I'm also looking at the entire organization? Those are going to make these, you know, your remote audit's going to change quite a bit between what you focus your actual audit on. And then is it internal versus external? Again, is it something we're doing inside? Or is it something that we have someone that's dictating this for us as we move forward as an external, whether it be your client? Maybe we're the ones doing the external part of it's a vendor auditor. So what do we have to deal with within those challenges between internal versus external? And then of course, storage. And you're not going to think storage is such a big deal, but storage is a huge challenge. So start thinking about it from this standpoint. What are you going to do for naming conventions? Are you going to keep the same name for everything that you're compiling for this audit? Or are you going to change it to something different that makes it a little easier, maybe for the auditor or the company or the external auditor to understand what they're looking at just based upon the actual title of it? You know, that's kind of in a different mindset. One of the issues that we had to address within our own challenges of this at the BL3 facility was they had their own process for how things were taken care of. So paperwork, of course, could not come out because everything was looked at being contaminated. It had to be autoclaved, destroyed, taken out of the room. We, of course, can't get rid of our paperwork. So everything had to have pictures taken of it. So every piece of paper that was generated had a picture taken of it. And sometimes they were taken multiple times. Could think about a temp chart. They're taken once a week, once a day, just so someone can manage to review them to make sure that they're being done appropriately. So now you've got a piece of equipment that's going to have multiple files with multiple days that are on it that now have to become part of that whole entire record. How are you going to store it? How are we going to have the naming convention of it? We ended up, like I said, they had to take pictures in the BSL3 facility for us. So the pictures were being taken. They had to go in a set file, which this was part of the BSL3's facilities procedure, so it was fine. But they had, went into a certain file on a shared drive. The individual that was in charge of that facility had to review all of it to make sure that it could actually be let go, that it could go out to other individuals. So we were waiting for paperwork based upon their requirements. And the individual would review it, he'd send it on to us, and then we could start reviewing it. And then it would, you know, it's moving from file to file to file as it's going through the process. So we're having it unsigned off and then signed off, different naming conventions as it's going through the process. And it gets a little complicated to keep track of where everything's gone and is it pending, has it been reviewed? And so we've had to be, and it is more of a challenge than you think, just trying to think about the storage and the naming conventions and how you're going to handle all of this. More challenges, of course, is going to be if, for time constraints. You wouldn't really think about it, but we had issues. Our audits must, audit might have to be completed on a set schedule. One of the biggest issues we had is, again, with the reviewing of the paperwork, you needed to have things done. So then that way you could send out those results. So, audits have to be completed on set schedules. So you do have time constraints on trying to get things done. Procedures or productions may be halted during this time point or behind schedule. So now your audits are behind schedule because of that. You might have the vendor issues like I talked about. Sometimes the resources aren't there for them to send you your ordered product, and then you have to look for substitutes that would work. Maybe you have layoffs that are within that company that's doing the production for you, or even the vendor. And so you're working around time constraints because they can't fulfill everything in the timelines they needed. Maybe your own company has layoffs and you're taking on more work. And so now you're having to pick up the slack for someone else that wasn't able, that's no longer there within the position. There's a lot of time constraint issues that may be involved that you would have to make sure that you're looking at and taking care of and managing as you go through this process. Electronic means, this is actually a fairly good sized challenge. Zoom meetings, of course, everybody has the Zoom or some video platform, one that's out there. They're very easy to use. I think there's GoToMeeting, there's Skype, you name it. There's a lot of different options for people. They're very easy to use. You can record them just like most of us are recording on Zoom for these presentations. And you can share screens very easily. So it's very easy for an auditor in this kind of situation to say, well, can you show me where's that quality paperwork that shows that you qualified that standard or you qualified that control. And they can bring that up and you can go through the process. So it's really easy to do those in that sense. Emails are something that everyone does. We email a lot, and through this remote time, we've done a lot of emailing back and forth. It's not considered the safest means of sharing sensitive information though. So you may have to think through your own policies or maybe talk with your IT group to determine what can I really email to somebody and what can't I. And then of course the faxing from a computer, I had to learn this not too long ago. There's actually some companies out there that want still things faxed to them. Well, if you're not at if you're not in the office, how are you supposed to fax? Well, we've got a lot of options now for faxing from your own computers. There's a lot of different systems out there that you can download and do. But then the question becomes, how secure are those? So then the challenge becomes, is this a secure means for us to be sharing information back and forth? Is it out there in the internet that someone can get a hold of if we're not careful? Now, generally, the most secure option for sharing information is a secure web portal. We've done this a lot with other clients that we've shared information with. And it's really nice in the sense that everything that you share with them is encrypted and it's sent to them. They then control it at that point. They house it, they take care of it. They deal with it from their side, from that part. But that's, these are some of the issues you need to kind of think about within the challenges. What electronically can I have available to me that I can share this information back and forth? Is it secure? Is it not secure? And a lot of thought has to be put into the secure and not secure part of it. So then that brings us to risk assessments. That is actually one of the best things that we need to talk about. And that's probably one of the things that most of you probably don't think we would have to discuss. But within this, you really need to start looking at risk assessments. When you start to do your remote audit, are you going against your own organization audit practices and procedures? Or maybe we doing something against a client agreement or the client confidentiality that we've signed into place? You really have to review those and make sure that the way you want to do your remote audit isn't going to end up causing data integrity issues or data security issues. And again, when we were talking about the electronic means, that's kind of where this goes. And also the risk, we're going to be talking a lot on email, even with our own employees, coworkers. How are we storing that? How are we doing the naming convention for that information? Some of this now probably is going into play. You can't just go from one cubicle to the next cubicle to talk to your teammate to find out how to handle something. So how are we dealing with this from the standpoint of keeping track of how we're moving forward on information? How are we storing this? And who deems it's important to keep and not important to keep? And again, that's kind of a risk you need to figure out. Is it something that's major or is it something that's not? Can all aspects of the study or standard be evaluated effectively? That's really something that you need to look at pretty hard as you're going through determining what to do with your remote audit. Will I be able to look at everything I need to look at? Is this going to work or is it not going to work? And that scope of limitations, as you start to kind of figure it out, may hinder your ability to review the needed procedures. So if you tried to make it a very simple audit, you may have put yourself into a hole where you can't really get all the information you need, and you need to look at it from a different perspective. So then, of course, depending upon everything that would come through with the risk assessment, we probably will need to have to adapt new procedures or revise existing procedures so we can address any of these gaps that we found, whether they be security-based or compliance-based. But this is really something you need to look through as the risk part of it. You're probably going to be surprised by as many options or as many obstacles that you find within this that you need to look through. Now, of course, this is the hardest one, documentation. What do we want? What do we need? And what do I want prior? What do I want during? What do I want after? So everything's going to hinge on this scope and purpose. So we're going to have to define that, and you're going to have to define it really well. Now that we've figured out any gaps that we have for security and any of those issues, now we're going to look at the standard, or we're going to look at our client information. We're going to determine what we need. So is this going to be an issue that we just want to look at certain dates for testing or production? Maybe we only want to look at certain test methods. Maybe you only want to look at certain pieces of equipment. Maybe you only want to look at some reagents and controls just to see, you know, a random kind of searching for it to give you enough information. Maybe you just want to look at a couple of personnel, you know, and it would be a good idea to ask for workflows. It really would be a good idea. And this will kind of give you an indication of how things play out. So when we were working with the BSL-3 facility inside of that, this was something that we needed to understand. We got a layout of the whole rooms. So we had, it's called a suite. So we had the layout of it. So we knew where the rooms were laid out. So how you could get into one or the other. We also asked for pictures. So they went in and took pictures of the rooms. So that way we saw the layout of each room, more specifics. We'd know where the bench top was that they were working on. We know which BSC they were in to do what. We know which pieces of equipment they were using. Since this was a facility that was not owned by us, it had a lot of different pieces of equipment in it, and that would help work for other individuals so they could come in and then they can do their work there. So it wasn't exactly everything in the room was something we would use. So there was a lot of unused equipment and some space. So that became our issue to make sure that it was there. It's a good idea to ask for that, really, for an understanding of what you're looking at. Communications, again, as part of the audit documentation, maybe you're going to ask for communications that were back and forth. Maybe all the training happened on email, and so you're going to have to get the training documentation as an email system, you know, within their email system. You want to make sure you give them set days, times, and agendas for each day or time. You know, and it's going to take a while, because generally, I don't know, but maybe most people, when we had audits, you were in them for 2 days at least, maybe longer, and it was all day long. You broke a couple of times for lunch or for a break in the middle. You know, how is that going to look on Zoom? How would that look there? And how can you make it manageable? And then, of course, you need to make sure confidentiality agreements are in place. Each company is going to be a little bit different on that, but there's going to be a lot more sharing that you take with you from this side of it, from a remote standpoint. And most of the time in audits, you would hand somebody a document, they would read it, and they'd hand it back to you. This is going to be a shared, most likely you're going to share it with them, and they'll have it more long-term. So what's those confidentiality agreements going to need to look like from your standpoint as a company as well? During, of course, you know, you'll have it as a video conference platform. Here's the video. Record for future references if able. This is one of those things, I don't know how many companies are going to let you do this, but hopefully a lot of them will let it happen, or maybe they'll let it happen just on their end and then they'll share it later. But hopefully you can actually record them, because I think this would be a valuable tool for everyone to go back to, just to make sure they remember what was said and how it was said. Review evidence for accuracy, completeness, relevance, and reliability. That's the challenge during. You have to make sure everything you've asked for is what you've received. So that way we can make sure that it is complete. And it is the auditor and the company's responsibility to ensure evidence is given, reviewed, is correct as requested. So it's everyone's job to make sure that what we needed is what we got. So that way the audit goes smoothly and you're not found non-compliant for something that was a misunderstanding or an incomplete submission of information. And then of course, we'll probably have to follow up with an exit meeting as well, and maybe have to ask for more supplemental documentation as information that we needed there as well too. So in conclusion, for the most part, remote auditing, I'm pretty sure this is going to become part of our future, at least to some extent. I think there's a lot of good merit to this. I think there's a lot of good ways for us to figure out how to move forward with this, to continuously improve all of our processes. I really think it's helpful in that sense. I think hopefully it would be that some regulatory groups like FDA, CLIA, maybe some of these other regulatory groups could actually come up with maybe a guidance document on how they expect remote auditing to happen, or maybe they're already figuring out on their own what they're going to do for a remote audit. And maybe it's pieces and parts. Maybe they start out with, remote auditing is a smaller subsection of just minor things. And then, you have to have an on-site at some point to handle the rest of it. Discussions about remote auditing need to occur at all levels. This is within your own organization, with your clients, with your vendors potentially, with the regulatory groups. This is how are we going to deal with this on the short term? How are we going to deal with it in the middle of this stretch, so to speak? And then how do you deal with it long term? These discussions need to happen, and even if it's just within your own organization to begin with, they still need to occur. And of course, we're going to all have to write procedures for remote auditing. And they may look different, and they may be very engrossed or intertwined into data integrity and data security at this point. But this is definitely something that needs to be looked at, and we need to move forward with it. So thank you very much for your time, and I welcome any questions that you have on it. Thank you again.